health informatics. Sorry, just to know, we will be recording this for the benefit of anybody who wasn't able to make this slot. So if you don't want to appear in the video, keep your camera turned off. I was just about to introduce myself. So I'm Paul Taylor. I'm a professor of health informatics here at the Institute of Health Informatics at UCL, and I'm the co-director of the program with George. So George, why don't you go next in introductions?
Hi, my name's Georgina Moulton, or I'm known as George. I'm based at the University of Manchester, and I'm a professor of biohealth informatics and education, and I work alongside Paul on this programme.
So Vishali, do you want to go next?
Hi there, I'm Vishali Damoda, and I'm the Education Administrator for Health Informatics. Sorry, I don't have a camera on my desktop, that's why you're not able to see me.
Tanya?
Hi, I'm Tanya Harbinson and I'm Administrator at UCL alongside Prashali.
And Alison.
Hi everyone. Yes, thanks so much for joining. And yeah, my name's Alison and I work in the Faculty of Population Health Sciences, which the Institute of Health Informatics sits under.
Okay, brilliant. So I'll just say a few words of introduction about the programs while you think of your questions. It's really going to be up to you to drive the session forward. But we've done this over a number of years, and I'll just anticipate some of the questions that are commonly asked. I suppose to start with, the first thing to say is what health informatics is. So health informatics is the study of how information and information technology can be applied to improve the organisation and delivery of healthcare. Now, I've been involved in the field for a long time, possibly even slightly longer than George. And in that time, it's evolved from being the study of really being focused originally on computer systems and how to make better computer systems for healthcare professionals to do their work. And now, although there's still an element of that, it also includes systems like apps, which are used by members of the general public to help manage their own health. And increasingly, there's a focus on information and how we can better analyze the information that's generated during healthcare in order to derive insights about disease and the effectiveness of treatments and so on. So what you learn when you're learning about health informatics is partly a kind of an application area of computer science to a very important business area, an area of life. And it's partly some more specific skills which are particularly relevant to the use of information technology in those areas, and some aspects of statistics and analysis. And also, very often we focus on some questions to do with how you make computer systems work in complex organizations like hospitals and other healthcare organizations. So that's what the content of health informatics is. And within the particular educational program that we offer, we're very keen that we're focusing on trying to train individuals to take up leadership roles in the transformation of healthcare organizations to take better advantage of digital technology. So we see our graduates go off and take up roles in organizations like the NHS, also sometimes in consultancy organizations and tech firms. But they're not, we don't train people to become computer programmers. It's really about teaching people to understand how technology works in healthcare and how you lead projects that are going to go on and transform healthcare organizations to enable them to better use technology. So that's a little bit about health informatics, a little bit about our approach to it and where we see ourselves. And then the detail of the program is it's a modular program. There are each student will take 8 taught modules to get the diploma, and then if you're going on to the MSc, you take a dissertation after that. Each module lasts 8 or 9 weeks and is delivered largely online in our virtual learning environments. but with 3 days of quite intense face-to-face contact, either at UCL or at Manchester. So that's probably enough from me. George, is there anything you want to add to that before we turn it over for questions?
I think I'd emphasise that we take people from many different backgrounds for health informatics because it's a multidisciplinary science. And in many ways, that's represented in the team that actually deliver the programme. So we have people that are computer scientists, people who are statisticians, but also more people that focus on social sciences who can do more of the qualitative research and in how to interact with people, for example. So we are looking for people that come from these diverse backgrounds because actually the programme is about bringing these backgrounds together in order to solve these kind of wicked problems that require people that know about the data, that know about the methods and know how to introduce a digital technology into complex organisations. So I think that's one thing that I'd really like to add. The second bit is what we tend to do is Paul mentioned that we do some material online and we have 3 face-to-face days. What we'd like to do is give you the material that's giving you the foundation of the concepts and the knowledge that you need to know in order then to apply those in the face-to-face workshops. So they're very problem-based driven, and those problems are coming from real-world situations, either from our industrial partners or from the NHS trusts that we work with. And so you get a real flavour of how to apply that knowledge in the most up-to-date issues that we are facing. And once you've done that in the taught modules, that dissertation module that you do, which is where you bring all that knowledge together and you investigate something in depth, that's when you get a real chance to work with those either partners or with an academic to do your own piece of research. There you go.
Okay, so I think given the size of the group, then I'm happy for people to just unmute and ask a question. I noticed Anna's put a question in the chat about PhDs. We weren't planning to talk about the PhD programs today. I mean, both UCL and University of Manchester do have potential for doing PhDs in health informatics, but we don't have a joint award. So we weren't planning to talk about that today. If you want to find out about that, then have a look online and then maybe follow up by email.
I was wondering, Paul, if you might be able to talk about how it works in terms of logistics with Manchester and UCL. I think I'm kind of curious about that too.
Yeah, so well, it's as we've said, it's a blended learning program. So the vast majority of the time, the people are studying remotely. So it's delivered via a virtual learning environment to students who are scattered all over, principally in the UK, but sometimes overseas as well. But once in every module, so and each module lasts 8 to 9 weeks old, so that's the kind of interval. People come together either at UCL or at Manchester for 3 days. And as George was saying, the way we try and do it is that the kind of didactic element, so the bit where you're kind of learning passively and going through written material and lectures and so on, that tends to be done online. And when we bring people together and have them all in the room at the same time, we try and get them to work on problems and practical exercises in small groups as a collaborative experience. And so the face-to-face sessions will alternate. So one module, the first module you'll take will be the Essentials of Informatics Healthcare Systems. That's delivered at UCL, and so the face-to-face teaching will be at UCL. And then the next module you take might be Health Information Systems and Technologies, and that's led from Manchester. So the face-to-face teaching there will be Manchester.
Amazing. And do international students tend to travel to the UK for those?
So it depends on the it depends on the arrangement. So an international student who's coming to the UK to study this course on a student visa will relocate to the UK and will base themselves wherever is convenient or appropriate in the UK, and will travel to London if they're based in Manchester, and travel to Manchester if they're based in London. So the admission requirements are, we require everybody to have a good first degree. So in UK terms, that would be a 2-1, the equivalent in whatever educational system you have. And we will look at the what discipline that's in to check that we think it's relevant. We do get a lot of people coming who actually don't have, who actually changed subjects in the course of their career, and maybe they did a first degree which isn't relevant to health informatics, but then they've got some subsequent training or professional experience which helps us be confident that they're on that journey and that they're going to be able to cope with the program. So we don't have a strict definition of what your first degree has to be in. Normally people who are applying will have done something in either a clinical specialty or maths and computer science and statistics, or something relevant to biomedicine. So it's quite a broad portfolio. And one of the things which I think is important to tell you about the program is that it is intentionally multidisciplinary. So it's always been part of our philosophy in designing the program and running the program, but we want to have a classroom which includes people from as many different perspectives and experiences as possible, and particularly to have people from a clinical background, from a biomedical background, and from a sort of computer science and technical background as well. In terms of career prospects, the program really originally was designed for people in full-time work, working in the UK, and most of the students on the program came from NHS organisations, and they wanted to do a qualification to kind of further their career progression. Increasingly, we are getting people from a more diverse set of backgrounds. We're getting more international students, and we're getting people who are kind of moving into healthcare, perhaps from a different career history. And then they'll move on to roles in a variety of organizations. So very often they're moving into they'll work in a healthcare organization, helping deliver digital transformation projects in that organization. Some of them go on to work for companies that sell IT products and services into healthcare, and some of them go on to work for consultancy organizations or pharma. George, any other thoughts on that?
So I think you're right, Paul. Those are the main areas that people tend to go into. I think what I'd like to emphasize is that at the moment, health informatics, there is a demand for those in an international market and a national market for the people with those skills. And you can see that at the moment, if you look across different countries, the different types of frameworks that are available in terms of professionalization frameworks. So in the UK, we're currently developing that along with professional bodies, but also if you look at Australia and America and Canada, for example, they too have those professional frameworks. So what I'd like to add is that although we're accepting people from a wide range of disciplines and we're bringing you together to solve these problems, there is a professional body, there is somewhere where you can start to work with others and be recognised for working in this multidisciplinary space.
Any other questions?
I can always ask another question. I was wondering, dissertation topics, any, what people are researching and current topics.
So it varies. So a lot of people are on the program working in healthcare organizations already. So they'll tend to do a dissertation that's based in their environment. Obviously, it makes it easier to manage your work-life balance if what you're doing while you're studying is relevant to your employer. So, for example, I've got a student at the moment who's talking to me about a dissertation, and he's a radiologist based in the Channel Islands, and the hospital where he works has just acquired a product that uses artificial intelligence to analyze X-rays in the A&E department to get a better preliminary interpretation by the clinician reading them in A&E before they get the later, more definitive interpretation by the radiologist. And so his dissertation is going to look at the impact of that on whether it is that tool is actually able to improve the decision-making of the clinicians in that unit. So that's a very interesting piece of work. It's a very timely piece of work, and it could well lead to a publication. But it's very specific to him. Somebody else not in that setting might struggle to be able to do something similar. So we have two other categories of projects that people get involved with. One of which is when they have an idea that's developed in discussion with an academic, or maybe the academic brings the idea and suggests it to the student, and there the student will get involved in the project that the academics worked at. Maybe it's some part of a larger project the academics working on. Maybe it's something new that they want to explore, and those can be in the analysis of data. They can be looking at bits of technology, evaluating systems that are being developed by now partner organizations or trusts that we work with. And the final category of dissertations is ones where we work with a partner organization. So we sometimes work with external companies who are interested perhaps in recruiting students, or interested in suggesting ideas that students might be able to explore and working with them. So for example, last year I worked with a company called Health Navigator, which supplies a service to the NHS where they offer coaching to people who are struggling to manage their own health, to help them manage their own health. And this is a cost-effective intervention, because this coaching ends up meaning that these people are less likely to require acute services from the NHS. And then we've been looking at the data generated by this service and learning various things from it about whether you can predict which patients are likely to engage with it successfully, whether you can detect an impact from the service on demand being deflected to other parts of the health service and so on. That's an interesting kind of real world project that students can get involved with. George, have you got any examples you can think of?
Well, so what's quite exciting is that it's the dissertation day to day. So I think it's worth setting this in context, which is we're currently holding a workshop with the students now. So the dissertation runs over the whole year. And I think this is what really is a good thing about this dissertation, is that because it runs over the whole year, actually what you do is get to develop an idea and a proposal, and then you get to implement that proposal and then write it up as a journal paper. So not only are you going to learn about a specific area, you're going to learn about different types of research methods, key communication styles, and how to write and how to verbally present your work. So all these transferable skills that you need in the workplace, you also pick up through the dissertation module, through these workshops that we hold once every month throughout the year. So in terms of work that we've got going on, and it's live, we've got a student that is going to look at how quality indicators in NHS England are developed. So there's a process at the moment that goes looks at clinical groups and how to develop those quality indicators, and he's part of a team that drives that process. And what he's finding is that he thinks there's something in the process that is causing variability in both the description of the quality indicators and their usage. So we're putting together a proposal at the moment on how he can investigate what that process looks like and where the potential difficulties are that impact on those quality indicators. So that's one project. Another project is looking at mobile apps. So there's a lot of work around at the moment around personalised health, viewing mobile applications in particular areas. So last year we had one for menopausal women, and we found that there were not very many that were available. So we took key criteria for menopausal women. So we did interviews and focus groups, and then we used the information from those for symptoms and what they wanted to know about, and then use that as a framework in order to review the apps that were available, and then give a set of recommendations for future development of apps. We've had students go into and look at communication methodologies rather in critical care. So during COVID, there was a big swap between how people communicate with one another, from being face-to-face and in the ward to then different communication styles, sort of, and outlets being released, and they wanted to know the effectiveness of them. So there was a project that really looked at how those different communication methods were used, how effective they were, and again using methodologies such as focus groups and task analysis. And these are the types of research methods that you will also come into contact with in various modules of the degree. So there's lots of variation. There's those that are more on the analysis that Paul has described, and then there are others that are definitely looking into and using more qualitative methods, so engaging with the people and finding out what particular areas need to be improved.
Yeah, and they're
okay?
quite varied, aren't they, in terms of the methods that people use and the things that they tackle. We had, I mean, just to give you an example of the range of things that people do, we had a project from an international student a while ago, which was reviewing apps that advise on earthquake preparedness in a country where this was more relevant than it is in the UK. They're quite varied. So who's going to ask the next question?
I think there's a question in the chat actually, just about qualifications.
Okay, yeah, so we accept, as I said, we accept people from a range of different backgrounds. So a medical degree would be one of the degrees that we would consider relevant. So absolutely. We do get a small number of clinicians coming on the program every year. It varies. As I said, one of the students doing a dissertation with me currently is a radiologist. One of the people who worked with me on the Health Navigator, the dissertation with Health Navigator, was a GP. That came to mind because that work was recently written up for publication, which is nice. We've had people from other clinical backgrounds as well, pharmacists, physiotherapists, and so on. So definitely welcome applications from people with medical degrees.
I was going to ask as well, sorry, another question from me. But I just thought it might be helpful for attendees to know about how the sort of pastoral side of things works, in terms of, you know, are you more towards Manchester, or is your personal tutor at UCL, and sessions with your peers? Yeah, hopefully that might be useful for them to know. So
every student's assigned a personal tutor, and the personal tutor might be based in UCL, might be based in Manchester. We encourage the tutors and the students to meet, obviously when they're physically together and they can meet face to face, but to meet, I think it's twice a term is the kind of standard. It used to be the case that students tended to regard the personal tutor as somebody they could go to if they were in difficulty. We actually try and encourage people to contact the tutor even when they're not in difficulty, because there's always ways in which you can get advice and improve and be helped to do improve your marks and so on. The way the program works, if you have questions related to the content of a module, it's generally best to take them up with the module lead or one of the team delivering the module. And the role of the personal tutor is really for stuff that's generic in the sense of not tied to a particular module. And maybe that's to do with organizing your study, maybe it's to do with how to think about assignments, maybe it's to do with advice about career progression and where to go next and so on. We also have a nominated careers advisor. We have a careers event every year. I think there's going to be one at UCL in February. We have tried in the past to organize kind of peer networking events as part of the face-to-face experience. I don't know, I haven't been involved with that recently, but certainly it makes sense when the students are together for 3 days. Often some of them will be staying overnight, and there people can get together and start to build networks and so on. There's a social event at induction as well. So in addition to the face-to-face days that we talked about that are part of the modules, there's also a face-to-face induction at the start of the program. And then there are regular face-to-face days, as George mentioned, to help with the dissertation. So the contact time, although obviously it's different to a traditional campus-based master's program, there are more contact hours than you might think from a blended learning program, because we have these other events as well.
Well, can I just add something now? I think the personal tutor, like Paul said, is from Manchester UCL, and part of that support that we give is through actually those face-to-face days, and also through, I think, what are two very unique centres in research in health informatics at UCL and UOM. So, for example, there are lots of opportunities for people to actually take part in seminars that are either hosted at UCL or Manchester, or other activities. So there's the time here that you need on your programme to study. There's then this personal tutor that is there to support you in that broader context of where your direction is in your career or other issues. And then I think there is this kind of really strong research and teaching base at both those institutions that you can actively become involved in through attendance of seminars and other events. And I think it's kind of, once you start to build this network up and your framework for being able to interact with different people, you actually get very, very busy during the 2 terms or 3 terms of the programme.
I think
next question.
I think there was just a question in the chat about a document with the list of dissertation projects, or if there is anywhere where the dissertation projects are listed or previous ones.
Is there a document? I'm just trying to think what would be the best thing to do.
No, there isn't, but some are listed on our website.
Okay, so there are some listed on the website. I can ask the my colleague Matthew, who's the lead for that module, what would be, if there's an easy way that we can.
Yeah,
There's
because
a
we need
document
permission
to
from the student as well.
Well, that would be to share I don't think we're talking about sharing the whole dissertation document and just something with a list of titles, perhaps. I mean, there will be a list of the.
There is a document actually that lists.
Yeah, I was thinking there must be, mustn't there? Because the projects that are suggested by academics are then put together in a list for students to choose from. So we should be able to find that. Let me have a look on Moodle. But while I'm doing that, then do come in with other questions. It's going to take me a while if everyone's going to sit and watch me.
I was also going to ask, in terms of access to like resources online and, you know, just sort of like the virtual element of things. I know, you know, UCL have a lot of, you know, not even just in terms of, you know, academic side of things, but a lot of virtual events and virtual societies and things like that. But from an academic perspective, you know, access to materials and things like that, how it works.
So everything is done via Moodle, which is the UCL virtual learning environment. So each module will have its own Moodle page, and within that you'll get access to a list of topics, typically one a week, and that will be a mix of material for you to read. It might be recorded lectures as well, or some other form of content. And then there will also be a task to perform, or more tasks. And those will be things like maybe a small piece of written work, or a quiz, or just a discussion forum that you're invited to participate in. And then there will be, sometimes we do things where you have to submit a short piece of work, and then you provide a kind of peer assessment of somebody else's piece of work against agreed criteria. So there's generally in the Moodle content a mix of stuff that you have to absorb and stuff that you have to do. And of course, there's also their support for communication, both between students and with the module team. George?
So I think there is the virtual learning environment where you get the standard tools of doing discussion forums and things. What's really important though is that for health informatics, we use different types of software to do health informatics to solve those problems. So we use actually industry software as well. So some of the modules rely on Slack for communication. We use design software. So there's a lot, depending on which module you're studying, we will use those types of software that will support you in developing your studies. So for example, like our modern information engineering, where you're learning how to operate in teams and develop software, you start to be introduced to Slack, you start to be introduced to GitHub, some of the programming languages, and I think quite unique to this program as well is that at Manchester we've developed something called the eLab, which is a teaching support tool for health informatics and data science, and we use that as part of developing and delivering some of the teaching as well. So that's, you access that through Moodle, but it's using those different standards and those different pieces of software that allows you to work with health IT.
Next question.
And yeah, feel free to unmute yourselves as well if you'd like to ask it.
I've tried to find the
chat.
documents about the dissertations. I can't find anything. I'm sure we'll be able to get something that we can share.
Yeah, perhaps we can trying to think. Perhaps if they want to email into the administration team, it can be sent via email to you, perhaps,
Once we found it.
once it's been located.
Other questions?
Yes, one has just come into the chat actually, asking how much focus in computer science / programming does the course offer?
George, do you want to talk about the MIE module?
Yeah, so I would say there are a couple of modules in there that focus on that kind of aspect. One is the modern information engineering module that I referred to, which is really looking at how you design software using a software development process. So we use an agile project methodology, and that assumes no knowledge of programming or of computer science. So we will take you from having very little or no knowledge of computer science, and we will take you up to a standard where you are able to modify Python scripts, for example, use GitHub and other languages. So we will take you to that stage. We will not make you a programmer, okay, but we will give you the tools in order to then do that in more depth, should you so wish. I think the other module I would say is usable systems design, and this kind of looks at how do you make sure that interfaces and how takes a deeper look into how people interact with interfaces and what they should look like, and how do you go about designing them. And so again, we use different sometimes programming languages or software tools in order to be able to do that. And so again, we're assuming no knowledge of that. We will take you from little or no knowledge to someone that will be able to understand the process, what to look out for, the different tools and how to use them in that module. So I think those two modules in particular, we look at computer science and programming. Paul, do you want to touch on the kind of what you might do in the AI stuff, really? Because again,
yes, no, that's a good point. Actually, that's a good point. So we have a new module this term, which we haven't included this coming academic year, which hasn't been available previously, which deals with the topic of machine learning, which is obviously something which is increasingly used in healthcare and the analysis of health data. So the way that we will approach this will be not to assume any prior knowledge of a particular programming language. So we will work with a machine learning package which has a graphical user interface or a simple set of instructions which allows people to go through examples without mastering a particular programming language. Most of the tools that we use are written in a language called Python, and it may be that it's advantageous for people to have a look at some online Python training programs before that, or build that up through the MIE module. But it won't be a requirement. We will design the material so that it can be tackled without any previous experience of programming or of a particular programming. I should say, I suppose, that if you are coming on the program, it depends. I mean, the the program's designed for people who are interested in working in the application of information technology in healthcare. And for most of those roles, people aren't going to be sitting down in front of a computer and writing lines of code as their primary activity every day. So we don't focus on teaching people programming as being the main thing that you pick up. We try and engage with it because people have to understand something about what underlies the technology that we're talking about. And for some aspects of it, it's useful to have a practical engagement with the tools. But if your aim is to become a computer programmer writing software in the healthcare domain, this probably isn't the program for you.
No, thank you. Sorry, I just managed to get my mic working because I only asked because my background comes from radiotherapy. I'm one of a dosimetrist who does a lot of radiotherapy planning. And prior to working in the NHS, I used to work for a private company that developed AI technology in radiotherapy systems. I did more. I did more of the manual data input stuff, like creating CT data sets or editing them for training. So it'd be nice to actually understand a bit more about the training side of things. Especially from my clinical background, I don't expect myself to become a programmer or anything. But it was very nice to just have a bit of clarification of, is there going to be some sort of bridging between the computer science knowledge and the clinical knowledge? Because I feel as though
you need to do some practical. I think from our point of view as educators, it's the thing we perhaps struggle with most is getting the balance right. Because I think people do need to have some practical experiences. Otherwise, it all becomes a bit fluffy and a bit ill-defined. But we can't devote enough of the curriculum to programming to take people from being non-programmers and turning into programmers. So we have to get the balance right. And we've been doing this for a long time, and I think we do it as well as we could, but it is always difficult. And of course it changes because the nature of programming changes. And now you find that increasingly programming is about downloading stuff from GitHub and tinkering with it rather than starting from scratch. And I think the skills that people require are evolving as well, and we respond to them.
Great, thank you.
Other questions before we sign off?
If there's no other questions, I will just put this UCL scholarship finder in the chat for everyone as well. Do have a look at, if there's any scholarships that you might be eligible for. So I'll just do that quickly. I suppose if there's no other questions, you feel free to email into the education team. Shall I just put that in the chat as well? And Tanya, would that come through to you?
IHI Education is the admin.
Excellent. Thanks.
So I've got a note in, right, and I'll elaborate later. So when you sign up later, you're planning for this program. 8 answers to combine. We've got 2 lists from each one. On this.
Okay. We done? Well, nice to meet you all, and I hope that was helpful, and look forward to hearing from you in due course.
Thanks so much, Paul and George.
Thanks, Alison.
Take care. Have a good rest of the day, everyone.
Bye. Good to
Take
meet
care.
you.
Bye.
So that is the one.